Then there's this: keeping doctors healthy could impact the wellness of their patients as well. Researchers are finding that medical errors may stem from burnout in the workplace. 55% of physicians reporting burnout and another 32% complaining of fatigue, according to a new Stanford University study. Joining us right now is Dr. Mikhail Varshavski, also known as Dr. Mike. Good to see you, Dr. Mike.
Good to see
Thanks
you.
so much. What is being done to make sure our doctors are staying healthy and characterize the issue for us?
Well, the first step of this is identifying that there's an issue in the first place. And this, alongside with abuse of healthcare workers, assaults on healthcare workers, are two important issues that have been overlooked. And when we're talking about physician burnout, we're really talking about three things: physical and emotional burnout, where you're just becoming tired from making a lot of decisions all day. Number two, depersonalization, where you become cynical, you become sarcastic towards your job and your patients. And the final piece of it is that you start noticing a trend where you decrease your sense of accomplishment. You don't feel like what you're doing is meaningful. And that's coming from a burden set forth by electronic health records, administrators, the legal system, where it feels like everything you're doing is not accomplishing anything and the system is working against you. When I spend an hour with one of my patients, afterwards I have to spend 2 hours documenting the encounter, calling Medicare or Medicaid to try and get approvals for medications or tests. And this type of system is leading to this burnout that we finally have identified as being a cause of medical errors. Before, we used to say it's errors in communication, it's a lack of checklists, and we used to blame it on system-wide errors. But now we're finding it has something to do with physician well-being. It's so important that we tackle this issue.
Sure.
Well, how do we tackle it then? I mean, we're talking about this. I mean, and it seems a lot of it is rooted in regulation. I mean, there's HIPAA laws, there's Medicare, Medicaid. I mean, how do we address this? Because to me, it seems overwhelming.
So hospital systems are taking really good steps towards attacking this issue head on by hiring wellness officers, by giving doctors ways to put an outlet to their stress. They're giving them mindfulness apps, and this is great. But really where the biggest work needs to be done is attacking the administrative burden that's set forth to doctors that is really unrealistic. It's insane that if I'm ordering a simple test like a CAT scan or giving a medication that's widely used and I have to spend 30 minutes on a phone call arguing whether or not my patient needs that, that's a hurdle that's unnecessary for doctors and that needs to be looked at.
You make a great point, Dr. Mike. Thank you so much for weighing in on that. Mike Varshavski.